Hello, Miss Smith. It's Kathleen, your CNA. The nurse asked me to come in and provide some catheter care for you. I'm going to get the equipment and we'll get started. First thing you want to do is make sure you provide privacy. You want to make sure you have the right equipment for this skill in providing catheter care. So you notice, of course, we have our basin of water, we have our gloves, we have our soap, washcloth, and 2 towels. So now we're ready to start the skill. Now with catheter care, you also want to make sure when you see the bullets going up and you see those critical steps in bold, there are 2 critical steps. So you want to make sure that you do those exactly as they're written. So please pay attention to that when I'm doing it, okay? Now, of course, we've already checked the water to make sure it's okay. But again, on test day, anytime you're going to give care and you're dealing with water, if your patient is able to or not, you want to make sure that you try to see if they can verify the temperature. So on test day, you would just say, Miss Smith, would you check this water to make sure it's okay? Just a reminder to let you know to do that, okay? Before you start your skill, you're going to put your gloves on. Again, befores are very important. We're going to put our gloves on. Now, once we get our gloves on, one of the towels we're going to place up under her to utilize as a barrier so not to get her bed wet. You want to keep your patient covered up, maintaining that privacy. The first thing I want to do prior to putting that up under her is I'm going to just push her gown up out of the way, and you're going to be able to see me do catheter care in a moment, but you don't want to overexpose your patient until time. So you want to keep that in mind. So I'm going to take one of my towels, and what I'm going to do is just move this a little closer to me so I'm not reaching. I'm going to take one of the towels. I'm just going to leave it halfway, folded, and I'm just going to place it up under her buttocks. Okay? And you'll see the placement in just a moment. But right now we have to maintain privacy. So you have to, of course, do this with your patient maintaining privacy. Okay? Relax this leg here. We can relax this one. I'm just going to make sure that the towel is up under her properly. Okay? Now, in order to provide this care, I have to expose the area that we're going to be washing. So I'm just going to bring the sheet down just to her perineal area so that you can see what we're doing. This is the catheter. Of course, you guys know that this is normally connected to a drainage bag, but in this skill, you're just providing catheter care, so that's all you need to see. Now, here's the important things you want to remember prior to doing this. When you're doing catheter care, you want to make sure that you're holding the catheter up here at the meatus. That's very important because when you're washing down this tubing, you don't want to pull on it. So you want to make sure that you hold it. What you want to do is kind of hold and just kind of push forward, and then we're just going to take the washcloth and go down the tubing. We're going to wash and rinse the tubing. In this skill, you're just providing catheter care, so that's all you want to demonstrate. In reality, of course, we provide perineal care, and then we do catheter care. But again, for this skill, we're just going to demonstrate catheter care. Once you expose the area, now you're ready to actually start the washing. So you're going to take your washcloth. You're going to put some soap on the rag. Okay? You're going to hold up here at the meatus, and then you're going to come down the tubing, gently lifting. Don't pull, just gently lift. You want to change positions of your rag with each wipe. We'll do that at least 3 times, or in reality, of course, as many times as necessary, each time changing the position of our rag. Hold and wipe down. You want to rinse that tubing off the same way you washed. Again, critical steps. Hold, lift up, wipe down. We're going to do it again. You notice in healthcare, we like to do things in 3s. No less than 3. May have to do it more than 3, but no less than 3. Okay? Now you're going to dry the same way. This time holding, you just kind of gently pick up that tubing and just kind of pat down that tubing. And you know I'm going to do it a minimum of 3 times. Changing the position of the towel each time. Remember, they're watching how you perform this in regards to holding on at the meatus. Okay? Now, it also tells you to go at least 4 inches down the tubing. Don't worry about guessing what 4 inches is. Your finger's like 3 inches. One more indent would be 4. Just go all the way down the tubing. You can't go wrong. Okay? Just a little inside tip for you. Once you've done that, you're going to cover her back up. At this point, we're going to go ahead and remove this towel that's under her. Okay? Now we're ready to go over to the sink and, of course, discard our water. Okay? And then we'll come back and get her situated. So if you would, follow me over to the sink. So now we're going to empty, rinse, and of course dry it out. Now, in reality, when you're doing catheter care, you would want to empty this water into the commode in your patient's bathroom. But in that we use the mannequin, and it's just for testing purposes, it's okay to empty it in the sink. Once you empty, rinse, and dried, you want to now place this in the designated dirty supply area. Now we're ready to go back over and get rid of our linen. Okay, we're going to get rid of our linen. Okay, we're going to go back over to the bedside to make sure Ms. Smith is okay. Okay, so once you've gotten rid of your linen, you're ready to take your gloves off. You're going to throw those away. Of course, you'll say at this point, I will wash my hands. And now you're going to give your patient their call signal. Ms. Smith, here's your call bell. You just give us a call if you need us. And make sure the bed is in its lowest position. The skill is now complete.